Hello, curious humans, and welcome back to the show that keeps explaining the most interesting things happening in skincare with the honesty those things actually deserve. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who is about to tell you something about hyaluronic acid that nobody in the marketing department wanted included in the brochure. Dr. Lazuk is not with us today because she is currently inside a microneedle fabrication laboratory outside of Zurich, Switzerland, having accepted what a colleague described as a brief tour of the dissolution science. She has been there for 4 days. The research team reports she arrived with two questions and has since generated an unreasonable number of follow-up questions about molecular weight gradients and layered HA release at varying skin depths. She has also reorganized their entire clinical outcomes library by skin condition at the time of application, which the team initially found surprising and has since described as exactly how it should have been organized. She has requested access to a second data set. They have provided it. We have made peace with the situation. So you have the avatar. And today we are talking about something that sits right at the intersection of elegant science and enthusiastic misunderstanding. Chi microneedles and what they actually do, and perhaps more importantly, what they do not. Let us start with what most people think about hyaluronic acid. They think about it as a hydrator, a plumper, something you apply or inject or layer until the skin looks smoother and feels more comfortable. And none of that is wrong, it is just incomplete, because the real story of hyaluronic acid has always been less about the molecule itself and more about where it ends up. Here is the problem that most skincare quietly runs into without anyone explaining it clearly. The skin barrier exists for very good reasons. It regulates water loss, blocks environmental intrusion, and protects the internal balance of everything underneath it. But that same barrier also limits how much of anything useful actually gets through to the layers where it would do the most meaningful work. This is why skincare plateaus. Not because ingredients stop working, but because topical delivery reaches its ceiling. HA microneedles enter the conversation precisely at that ceiling. They are often described as a way to push ingredients deeper, but that framing oversimplifies what is actually happening. These are not needles in any traditional or intimidating sense. They are dissolvable structures made primarily of hyaluronic acid itself, designed to gently breach the outermost barrier and then disappear, releasing their payload exactly where topical products cannot reliably reach. This changes the conversation from penetration to placement. And placement matters enormously because hyaluronic acid behaves differently depending on where it is. On the surface, it binds water and improves how skin feels. In the upper layers, it supports hydration gradients. Deeper still, it becomes part of the extracellular matrix, a space where hydration influences cellular communication, not just appearance. Hydrated skin at that depth does not just look better, it functions differently. Cells communicate more efficiently, inflammatory signaling quiets, enzymatic processes stabilize. When hydration exists where it is biologically meant to exist, skin behaves younger, not because it has been filled, but because it has been supported. Now, here is where the misunderstanding almost always arrives. Deeper delivery does not automatically mean better outcomes. Skin is not a sponge, it is a regulated environment, and delivering hyaluronic acid below the surface only produces meaningful change when timing, skin condition, and concentration are actually appropriate for what is being asked of the tissue. This is why some people find HA microneedles quietly transformative, and others feel nothing at all. High microneedles work best when the skin barrier is intact but underperforming. Dehydrated skin, stressed, aging quietly, or simply not recovering efficiently tends to respond very well. Skin that is already compromised, inflamed, overexfoliated, sensitized, or recovering from aggressive treatment may not tolerate even a gentle barrier breach. In those cases, the skin's entire priority is repair. Introducing microneedles too early does not help, it prolongs the problem. Context matters more than trend, every time. There is also a confusion worth addressing directly. HA microneedles are not the same thing as microneedling, and conflating them leads to completely wrong expectations. Microneedling devices create controlled injury to stimulate a wound healing response. HA microneedles create controlled access without injury. One relies on the skin's repair cascade, the other relies on precise dissolution and placement. The goals are not interchangeable, the experiences are not interchangeable, and the results should not be compared as though they are. Here is what HA microneedles are actually doing when they work correctly. They are not reshaping the face, they are not correcting structural aging, they are not lifting descended tissue or correcting deep laxity. When they are marketed as solutions to those concerns, disappointment follows every time because the problem was misidentified before the solution was chosen. What they do quietly and genuinely well is restore internal hydration balance in skin that has lost efficiency, the skin that is not broken but is no longer quite right, where hydration does not hold the way it used to, where fine lines linger longer after expression than they used to, where recovery from stress, travel, or mild procedures feels slower than it should, where the skin looks acceptable but does not feel resilient. This is the quiet stage of aging that most products struggle to address, and it is exactly where HA microneedles, used correctly, produce results that are easy to overlook if you are expecting drama and impossible to miss if you are paying attention to how your skin actually behaves. Redness decreases, texture evens out, sensitivity decreases, makeup sits more smoothly, the skin feels calmer, more predictable, less reactive to the normal stressors of everyday life. Not cosmetic excitement, functional improvement, and functional improvement built quietly over consistent time is what actually lasts. A few more things worth knowing before you decide whether this belongs in your strategy. Overuse is one of the fastest ways to undermine the benefits. Skin needs time to integrate signals. Repeated barrier disruption, even gentle disruption, accumulates. When microneedles are treated as a weekly fix rather than a strategic tool, the barrier weakens and results flatten. Better delivery only works when the skin is allowed to respond between sessions. Stacking them with too many actives simultaneously creates the same signal saturation problem everything else in skincare creates when layered without restraint. More delivery is not always better delivery. Skin thrives on rhythm, not overload. And they are best understood not as a standalone solution, but as a support modality, something that enhances how everything else works, that maintains the internal balance that allows other treatments to perform better and last longer, particularly valuable between more intensive interventions, during periods when the goal is maintenance rather than change. Not replacement, refinement. This is what precision in anti-aging actually looks like. Not pushing harder, placing smarter, not adding more, positioning correctly, not escalating, restoring the conditions under which the skin already knows how to function well. And when that balance is restored, the skin does not announce it dramatically, it simply holds itself better, day after day, quietly and remarkably. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice or a clinical recommendation for your individual skin situation. HA microneedles, like all treatment modalities, should be discussed with a licensed professional who can assess your current skin condition, barrier integrity, and goals before recommending anything. Please consult a qualified dermatologist for personalized guidance. Dr. Lazuk will be available for consultations as soon as the Zurich dissolution data set is complete, and if someone successfully negotiates a departure time, she will honor. May your skin always glow as brightly as your smile.